everybody. Welcome to Beauty and Brains with Dr. Zuri Dale. The Beauty and Brains podcast is all about all things beauty, science, wellness. And the topic today is one that I think all the girlies want to know about. It is something that everybody's talking about. It is this weight loss craze. We have heard all of the things, the Ozempics, the semaglutides. You'll pronounce it correctly for us, all of the things. And that is what we are going to be talking about today. But first, I want to introduce our guest, Dr. Brandy Williams. Tell us a little bit about yourself.
Hello, I am Dr. Brandy Williams. I am a pharmacist. I graduated from Texas Southern University in 2007. I'm a native Houstonian and I love all things medicine.
Good. This is perfect. So when I thought about this topic, I'm like, Brandy is like the perfect person to bring on to talk about this. So let's just talk in general. Let's just talk about these weight loss shots. Let's just talk about, I think people really don't know the difference between them. They just kind of know what they see on social media. But this has actually been around. This is not new. So let's talk about it a little bit.
Correct. So it's the weight loss frenzy is what it's transpired into right now. But it's weight loss drugs that have been around. I think they started maybe in 2012, between 2005 and 2012. Let me go back. So there's Saxenda, which was one of the first ones, and Trulicity, but those were given every day. And so they weren't really used for weight loss. They were more so used for diabetes, which is what they were created for, to treat type 2 diabetes mellitus. And what happens when a drug comes out, it loses its patent. More companies start to try to recreate the drug or try to create a better drug or try to take something from that drug and use it for a different indication or find a new indication for it. So in doing that, they found out that the drugs also help with weight loss. And then here we go. Here we are now in 2024, and over half of the United States is on the medication for weight loss. So there was a big frenzy before where diabetics couldn't get the medication because so many people were using it for weight loss. Yes, because the medication helps to drastically decrease your weight gain because it helps to let me go back. The drug itself is a glucagon-like peptide. So it works in the gut mainly. It helps to decrease glucose. It helps to decrease your appetite. And it helps to slightly increase metabolism. So that's how it's able to help with the weight loss.
And so let's go back to diabetes. I remember, at one point, because of the increased demand, there was a time when individuals who were diabetic could not get their medication. And I feel like people have held on to that tidbit. And here we are, it's the end of 2024, and people are saying, well, we're taking the medication away from diabetics. I'm like, pharmaceutical companies are keeping up with the demand. I'm sure,
Yes.
And so I think people who have not quite bought into it are using that justification as to why it may be morally wrong for people to take advantage of these types of, drugs. Like, what do you think about that?
So to be honest, if I could be absolutely honest, and it may sound a little crazy, it may sound a little contradictory. I was one of those people originally, especially because of me being in the pharmaceutical industry and knowing how the medication was on back order and how there was not a large supply of the medication and the demand was so in surplus that the manufacturers couldn't create enough to keep up with the demand. And so I had all kind of diabetic patients calling me basically in tears because this medication was pretty much life or death. Now, there are other medications, but this medication was used in patients that could not get their A1C down. So they could not reach their A1C targets. And so this medication was helping them. And I don't know if a lot of people know a lot about diabetes, but it's one of those diseases that you do not play around with. It can affect every organ in the body. So that made me, I'm really like a heartfelt person. So like, I was just like, really sad, and I felt like it was inhumane for other people to be using the drug for weight loss, which was so, I felt vain. But now I have a different outlook on it. So because of that, because the manufacturers were not creating it in large amounts to help with the demand, the FDA allowed compounding pharmacies to create the medication. And so that opened up room for you to be able to use it to cover everybody that had diabetes mellitus, and to also use it for patients who wanted to do weight loss. Because I think it is, I mean, weight loss is a disease state as well.
Right. And I think that's kind of where my opinion differed a little bit, because obesity is a risk factor for diabetes and heart disease and all of the things. And so for me, I felt that people should be more upset that this entire time there actually was an avenue to assist with weight loss that I feel like people of color were not educated enough about to take advantage of. So to me, I kind of felt like, I don't know what the statistics are on who was using the drug before versus who's using the drug now. I would bet on it and probably say that prior to it becoming a bit more mainstream or like reaching our reference group, you know, I'm pretty sure there were other demographics or non-persons of color who have already been using it outside of diabetic treatments. We're just kind of like finding out about it. And so for me, I always wondered, well, here's yet another thing that probably could have prevented people from developing diabetes and heart disease and all of the things. And we were kind of left out of the conversation. And so when I think about, you know, lowering your BMI and decreasing like the prevalence of obesity and how it can really prolong people's lives, it made me think a little bit differently. I mean, big pharma, they will rise to meet the demand when they have to. I'm sure they were happy that there was an increased demand, you know, on the products. I mean,
So with you saying that last tidbit, and then we can go back. So I've had drug reps come to me and questioning, hey, why are we not meeting the demand? You know, why is Nova, who creates Ozempic, and then Eli Lilly, who creates Mounjaro, why are they not making enough to supply the demand for both diabetics and for obesity? And this was a rep for Nova. They told me, and this, I can't quote it, right? Because it's just coming from someone who worked for the company at the time. But they said that within the first 3 months of releasing Wegovy, the company made $3 billion. And that far surpassed their goal for that year. So they met their target.
very
early on, they met their target. And so there was no
pressure.
There was no pressure for the company, or no need or no desire for them to continue to create it.
And spend the money that it takes to promote the medical science liaisons that they have to send all over the world to educate. It's like, wait, we made our money. There's no sense in spending any extra.
That is exactly.
It's still a business.
It's
a
exactly
business.
what happened. And so that, to me, goes along with your theory of we were just left behind. And it wasn't a matter, because in the United States, the obesity and diabetes runs rampant. And
it's one of the leading causes of death.
But more so for African Americans. And I never thought about it. I never thought about it that way, because the drug has been around for years, and they didn't just discover.
And they did not just discover it. And people were saying, oh, well, you know, we're utilizing this diabetic medication. But that is actually not the first example of a medication that was initially intended for something else clinically, but we found it to have other benefit. When you think about Botox, right? Like, we use it because cosmetically now, but that was not necessarily the original intention of Botox. But someone says, oh, hey, it could do this thing as well. And so now people, you know, get Botox for like cosmetic reasons. And we see it all the time. And it's not the first time that has been done. And that's just that's just the marvel of medicine and science. You create something for one purpose and you realize that it can do something else. And like, what's really so wrong with it? Yeah, what's really so wrong with it about advances in medicine?
And that's how you get the different indications for the medication. Because of discovery, because you create it for this reason, and then you discover, oh, it also does this. And it's a wonder drug. I feel like it's amazing the things that it also. I know there's been some negative feedback on how it, like this saggy face syndrome that it causes, or
but I'm asking this: is that like due to the weight loss?
It's due to the weight loss.
Okay.
Yeah, because it does cause extreme weight loss in the facial area, but you can tailor it. Like I tell my patients, people want quick results, and the medication does what it does on its own. You don't have to try to speed up your dosage in order to create this fast weight loss. But once people see, oh, I've lost 5 pounds in a week. Oh, I wonder if I increase my dose, how much I can lose in a month. If I can lose 15, 20 pounds, well, that kind of weight loss is drastic. And so I advise my patients to stay with the recommended guidelines. I advise them to stay on their dosage for at least 4 to 6 weeks. Take it slow. Even if you can stay, if that dose is, if you're reaching towards your target, and that dose is, you're steady having weight loss on that.
Yeah, it doesn't have to be in a week. You don't have 20 pounds.
Right. You don't have to go up, and you don't have to increase. Stay at your dose, and then you'll see minimum weight loss. But the difference in the physical features will not be as drastic.
Right.
So you won't have the saggy skin.
And I think too, like with that, it's like on average, I think outside of like the weight loss drugs, I think what healthy weight loss is considered to be about 1 pound to 2 pounds a week. That's with normal diet and exercise. So I would imagine, you know, losing really anything too much more than that, right? Because I've heard somebody say, I lost 15 pounds in a week. And I'm like, I don't really even know if that's safe. You may have lost the 15 pounds, but that's not even like recommended healthy, you know, weight loss. So I understand what you're saying. So let's talk a little bit about, so we talked about some of the different drugs that are on the market. You've talked about how they work. So again, it's not the drug itself that's causing you to, you know, lose the weight. The drug is causing slightly increased metabolism. The drug is causing decreased glucose production. It is causing a little bit of an appetite suppression. All of those factors combined are leading you to lose the weight. Okay, so thank you. So y'all got that? It's not the shot itself that's doing it. It's the biological mechanism, the effect of the shot and what it does physiologically that is causing you to lose the shot.
And it just mimics what the body is already supposed to do.
Yes, so that's the next point I want to talk about. So let's talk about sustainability. Sustainability. So I'll be honest, like I did the shot. Okay, so I did the shot for 4 weeks and I lost about 2 pounds a week. One thing I feel like that the shot did for me is that it kind of disciplined me and taught me. It taught me. So I only did 1 series, so 4 shots, and that was it. Because I was really interested, because I was like, I'm probably going to be one of those people to take this shot and it's not going to work. Let me see. So I took the shot and it actually worked. But I feel like more than anything, it taught me that if I'm eating relatively this amount and these things per day, on average, this is how much I would lose, you know, every week or so. And so I feel like in some ways, like sustainability, like some people stay on the shot, or let's say they increase their dosages, or they decide to stay on the shot long term, which I don't know how safe it is to do that. But for me, I feel like it was more of a, okay, I did this one time. I feel like now I kind of got the hang of it. I kind of know, kind of understand if I eat this much, if I do this, you know, this will be kind of where I am. What are your thoughts on like sustainability, on long-term weight loss, on using the shot or staying on the shot long-term, or trying to use the shot as a teaching tool? Like, what are your thoughts on that? Oh, how do you advise your patients?
It's exactly what you said. It's a teaching tool. Okay. It helps guide you in your eating habits. Because most of the time, I just told the patient this we eat for pleasure instead of eating
Not
for
even
health.
hungry.
You're not hungry and you're just eating or you're just snacking. And what the medication does, it prevents you from being able to do that. And so sometimes the medication, if you're eating something that you shouldn't be, like if you're on the shot, you shouldn't be eating medications that are high in carbs. You shouldn't be eating medications that are like fatty acids. You shouldn't be eating any of that. So fried foods, pasta, rice, all of that stuff, you shouldn't be partaking in that. And so snacking, cookies, sweets, your body will tell you, you will almost feel like you're going to vomit when you ingest that stuff. And so for me, I would think to the natural mind, that will let you know that it's something that you should not, that the body is not okay with you having.
So when you're off the shot, it's like, wait, I remember how I felt when I was taking it. So maybe this is probably not something that I should
It
be
should
doing.
be a psychological
A
thing.
psychological thing.
But unfortunately, I feel like for most people, they're so pleased with the amount of weight loss, and everybody wants to look like the glamour girl. What society makes as pretty, as beautiful, as thin, or my doctor says I'm a little bit obese, right? And
Girl, my doctor tried to tell me I was overweight as well.
yes,
That's how that is.
right. And so if that's the standard for America, then I'm not coming off the shot, right? Because I know for some people, they're not using it as a learning tool. They're just using it as a quick fix, right? And
So let me ask you this. So how much psychological or mental counseling happens when a person gets the drug? Or is it like, hey, this is a drug, this is how you take it? Or is it common to have some of those kind of psychological questions or conversations with the patient about, now, hey, you know,
now I do.
part of this is to help you, but then the other
Yes.
part of this is, don't allow yourself to be tricked into thinking that this is the only way for you to do it. And like, some people probably need like real psychological evaluation before they take this medication.
They do. That is one of the things that they need to try to incorporate in
Right.
as a
Medication therapy management or
and before you exactly before you get the medication, that should be one of the prereqs
right
to do a psychological evaluation. Now I keep it real with my patients. There is a point even when you're taking the shot, and I don't know if you experienced it, where the hunger comes back. So your body has completely metabolized the drug. And some people, the injection should last a week. Well, if I'm a high metabolizer of that drug, then my hunger may come back in 3 days. Yours may come back in 6. But I tell them, okay, if your hunger comes back in 3 days, you shouldn't run and take another shot. That is absolutely not recommended. That is where psychologically you should start to say, okay, I know I feel hungry, but I'm not hungry. I've already eaten, and you're eating smaller meals. So I've already eaten, so I'm not hungry. So don't give in to those cravings. And then once you get the shot, you're like, okay, I'm good again. And because I told them,
tricked yourself into thinking it's the shot that's doing
it's the shot that's doing it. Right.
And I tell people all the time, like, the body, like the brain is powerful, but it really does not know the difference between hunger and thirst. And so a lot of times you're really not even hungry. A lot of times you get you some water. The water, which is the remedy. But this one is true. Like our moms and grandmothers was not lying about this one.
Go drink some water.
I'm hungry. Go drink some water. Like, I feel like maybe they didn't have as much of an understanding of this, but the brain really does not know the difference. Like, the same hormones get released when you're hungry and when you're thirsty. And really, you can satisfy that by drinking water, which makes sense as to why I know with the shots, you are supposed to be drinking a lot of water.
To increase your water intake.
Increase your water intake.
Or a severe dehydration can arise from being on the shot. Most people, I can tell you from the patients that are coming to me to get the shot, most people are not. I evaluate them each time they come in each week, and they're just there for their shot, in which I try to educate, and I wish more practitioners would do that, but I can't speak for them or what or not they're doing, because right now, the demand is so high, I think people are just pushing it out. Yeah. Instead of really educating the patients on how to maintain on their own.
Right.
Because at one point you're going to have to stop.
You have to stop.
You're going to have to stop. Now, the ADA for diabetes, right? The American Diabetes Association recommends the shot for diabetes, for type 2 diabetes, in addition to metformin, which is another drug. But they recommend it because it does help with cardiovascular risk. So they recommend it for people who are at risk or people who have already some underlying cardiovascular infarctions. They recommend it for patients who have kidney disease or who are prone to kidney disease. It helps decrease your cholesterol. So it helps decrease your blood pressure. So internally, your body is healing from taking the medication, if you can pretty much say that. So it's actually healing other parts of your body. So staying on it long term, medically, is okay because the drug was originally intended for diabetic patients. So there's not going to be any harm.
Like a medical consequence to staying on it long term necessarily, because because diabetes is a chronic disease. Once you have diabetes, you can't get rid of it. So if a person is diabetic, they essentially, for the most part, will be on it for the rest of their lives anyway.
Yes.
Anyway.
So there's no
But there will. But let me ask you this. So just imagine that you truly were prescribing this for a person with diabetes. At some point, it's like with all drugs, I would imagine, depending upon the concentrations that they have, their body reaches a state where that particular concentration is not going to result in any more weight loss for them. And then maybe it increases. Like, how does that
That's correct.
work? Okay.
That's correct. That is actually what happened. Your body kind of reaches a steady state. And the medication no longer that's why you keep going up in the dose. So I could be at my target dose. Let's just say I'm on 60 units of semaglutide and I am losing weight on that. At some point, I'm going to have to go up in dose because my weight loss is going to taper. So I'm going to start losing less and less weight. And I'm just and I'm just going to be maintaining at that time. So some physicians are even creating or writing maintenance doses for their patients. So you're just maintaining the weight that you're at and you're not still losing the weight. But even that, I feel at some point you have got to take control and step off of the medication.
Especially if you are not a person who needs it
exactly
clinically to treat a chronic disease. Exactly. At some point, like you said, just use it as like a teaching tool.
A teaching tool, especially because it can have effects on your gastrointestinal system.
Okay.
So that's the scary part for me, because it can create bowel obstruction. And so if you're on it long term and you do not need it, you do not have type 2 diabetes.
Because the medicine is doing what it's supposed to do.
Exactly.
Well.
Exactly.
So now it's actually doing what it's supposed to do, and that could cause some issues.
Some gastric issues.
Right.
Now you can prevent that as well by maintaining. It's just backup, because it could cause constipation or it could cause diarrhea. So as long as you maintain your bowels, then you'll be fine. And so the medication itself won't cause this. It's just the constipation, the chronic constipation that you could possibly develop that could cause the obstruction.
So, okay, so I have a question. So, I feel like with the COVID vaccine, any other medication, it could be like millions of people who experience no adverse effect. We see a couple of stories in the news. Somebody experienced some adverse consequence, and we are generalizing that to the masses. Okay, so let's just, what are some of those? We talked a lot about, there are some things that the medication itself, is not causing, but just by virtue of taking the medication, doing what it's supposed to do, it can create some long-term GI issues. Is there any other serious health risk that is associated with taking some of the weight loss drugs?
The main risk is gastrointestinal. That is the main risk. Now, there are some side effects, nausea and vomiting. And so if you could go into a chronic state of nausea and vomiting, and for that experienced dehydration. And there have been few
Mhm.
that have been hospitalized
Mhm.
because of that. But that as well goes with maintaining, you're increasing your dose too quickly,
Right.
or you feel that you're nauseated and you are steady taking the medication.
Right.
If you're experiencing severe nausea, then you should come off of the medication,
Right.
because the medication itself doesn't necessarily cause you to go into a hypoglycemic state.
Right.
Which is why they like the medication, which is why the medication works for people that are not diabetic, because it's not going to put you into a diabetic state.
This is like, I really like this conversation because I think that we need to teach people, I mean, like how to speak about some of these things properly, because I feel like these weight loss drugs, it was a craze, but I don't think this is a craze anymore. Like, I really think that this is here to stay. You know, like I feel like this is one of those things that is not going to disappear. I mean, America is probably like one of the most obese countries. I wonder like what that's gonna look like in 50 years, you know, 100 years. But this is something that is here to stay, and more people are getting access to these drugs. So I think some of that continued education and using our platforms to educate people about them, how to speak about them. I hate when I hear somebody say that X causes Y. I'm like, you do not know that X caused Y. It may be associated with something, or you may see increase this, but everything is not causing some of these complications that you all, may experience. I think that's important to highlight. So let me ask you this. You probably can't answer this. What is your preferred drug? Do you have one?
Preference, it depends.
Okay.
So I don't have a personal preference because I have not tried the medication.
Okay.
But to be honest, I'm going to. I have not tried it because I'm currently breastfeeding. But I will be done with that in January.
And you're gonna be taking
And
the
I'm
shot?
gonna take the shot. I think I need to take it in order to be able to speak on it and to be able to successfully educate my patients. I think I need to take it. I have already stated that I'm not gonna be on it long. If we're talking about preference in the amount of weight loss that the drug causes, I would go with Mounjaro.
Okay. Is that the tirzepatide?
That's the tirzepatide. Okay. It's highly concentrated, which means it's packed with drug. So, semaglutide is a lower concentration.
Okay.
Well, semaglutide is Wegovy or Ozempic, and it's concentrated at a lower volume than the tirzepatide. And the tirzepatide itself was formulated after semaglutide. So they have found ways to impact weight loss based off of the studies
done
correct
from
Wegovy
and
exactly. So that would be my drug.
Right.
That would be my preferred
They've had
drug.
a little bit more time.
Yeah.
Yeah. Get it right.
They've had a little more time to get it right with the tirzepatide. And that would be my drug of choice. Now, the semaglutide or the Wegovy would be, depending on the person or depending on the patient, would be a safer go-to. Okay. Because it does not cause drastic weight loss.
Got you. Okay. So in terms of like the amount of weight that you would
lose
so
at one
quickly,
time, quickly, tirzepatide.
Okay.
But semaglutide is a slower rate, and I think the benefits will last longer. Okay. From the semaglutide versus tirzepatide because of the drastic weight loss.
Okay. Yeah, right. You losing it so quick and then you gaining it
and you're gaining it back. Exactly, because you have not trained your mind.
It's because you have not trained your mind
exactly.
to be able to the discipline, the sustainability over time.
Exactly.
So it's not the medicine itself, it's you.
Yes.
It's the consumer of the medication. Okay, so one last thing. For anyone that is out there that is considering taking one of the weight loss drugs on the market, what is the best piece of advice you can give? The reason I ask this question is this. I feel like we always tell people, do your research. But people don't really know how to research. So if you were to tell people, this is what you should be looking for, these are the questions you should ask your doctor, how would you advise them?
Take it slow. Don't get so caught up in the it's a journey, I would say. And I would tell them not to get so caught up in the amount of weight loss that they're losing per week and focus on their end goal, focus on being healthier. You're going to lose weight whether you exercise or not, but that's where the mental part comes in, where you need to start training your mind to come off of the medication. So you need to start doing your part. I always say, I'm gonna do my part and I'm gonna let God do his part. And I correlate that to using the medication. You need to do your part and you need to let the medication do its. So you need to start exercising. You need to start making sure you're doing smaller meals. But patients are confused. I had a patient tell me, well, I'm doing smaller meals.
Yeah, but it had
But I'm
3,000
still,
calories.
yes,
One burger. It's still small.
yes,
I'm just
yes.
like, yeah.
And
Yeah.
yes.
Girl, that calorie will kill us. That calorie counting.
And I was blown away because in my mind, if I'm dieting, I know that I need to cut back on the carbs.
Mm-hmm.
But in their mind, no, I'm cutting down the size.
Yeah.
I'm
Or
not,
the frequency
or the
at which I'm eating.
frequency.
So I
And
should be losing weight
so,
automatically.
yes.
Mm-hmm.
And so I would say to follow a strict diet, even though the medication does not cause you to be on a diet, you should still start because you're training your mind.
Training your mind.
And you need at least 21 days before you can form a habit. So I would say small meals, changing the way you eat, cutting out fried foods, cutting out carbohydrates, cutting out the sugars. And the medication also helps you with cravings. So things that you may like, even alcohol. Even alcohol, the medication will help with your cravings for alcohol. Like if it helps with I'm having a brain freeze, but I am what is it? If I have if I have abuse. Like if I'm an alcoholic and but that's not even the term that I'm looking for. Anyway, the medication itself can help outside of your cravings for food, outside of decreasing that. It could help if you are addictions. That is what I'm trying. So addictions, so smoking, it will help it will help alter that craving for nicotine. It'll help alter the craving for alcohol. So take advantage of those things while you're on the medication.
So
exactly. So that once you're off, you're a healthier version of yourself. And so that's what I would tell. And that's what I always educate my patients. And, some people don't really want to talk about the addictions that they may have. I encourage them to talk about it with their provider or with their physician or even with their pharmacist so that we could utilize that information to help you while you're on the medication. So that is what I would tell anyone who is considering taking the medication, to take it slow, alter your lifestyle while you're on the medication because the medication helps you to do it. And so I think that gives you the jump, to say, okay, I don't need these things.
And plan for the end.
Exactly.
I'm on it, but I need to plan for when I am off.
Yes.
This is like not forever.
Exactly.
And it should not be forever.
Right. Exactly. Unless you have diabetes.
Unless you have a chronic condition that means that you need it.
And the medication, I don't want some people get confused because of, like you said, the stories that have come out or the things in the news about, okay, this happened to this one demographic or this happened
0.001% chance.
Exactly, of this happening. But the medication is very, very safe. It's a very safe drug. Both of them, semaglutide and the tirzepatide, are very safe. And the things that they do inside of the body, decreasing the blood pressure and the cholesterol, are very helpful for you long term. So you end up, while you're on the medication, you feel healthier. You feel like...
And I'm thinking about like an individual who, has an elevated BMI. So they may be considered to be obese, right? But that obesity has caused them congestive heart failure. That obesity has caused sleep apnea. So now just by virtue of them losing weight, they have decreased incidences of stopping breathing at night when they're asleep, right? So it almost serves as like a treatment.
Correct.
The loss itself can be a treatment for some of these
Underlying
other
issues.
things. Yeah.
Yes,
Just
yes.
the overall,
Correct.
just better lifestyle. And
Correct.
I can appreciate that. And that is what gives me like a better, I guess, acceptance outside of just patients who are diabetic. Because like you said, diabetes is a chronic illness, but obesity is
As
too.
well. Mhm,
You know,
mhm,
so
mhm.
but
Yeah.
thank you. Thank you. Thank you. Thank you. This was an amazing episode. And I'm really happy that we were able to sit down and have this conversation to not just talk about something that's popular and something that could be considered to be vain or materialistic, but to really, really, really educate people because we know people are going to do these things, right?
Mhm.
Like, and we have a responsibility to educate people on how to do things safely. What
Correct.
I also can really appreciate about this conversation is that you are a woman of color in medicine. And I think people being able to see you in the field, in the profession, you are a trusted source. I know they have like that statistic. What is it? Like, I think nationally, within like a 5 to 10 mile radius of everybody in the world, there's like a pharmacy.
Oh, yes.
And people come in closer proximity to their
With
pharmacists than they do
to their
their
physician.
physicians.
Mhm.
And so this is a great conversation to have and just to highlight the impact of community pharmacy and getting some of that medication therapy management and the proper medical advice, especially if you do not have access to a primary care physician.
Correct.
So thank you. This is Dr. Brandy Williams, my friend, my colleague, and now a guest on the Beauty and Brains podcast. And we are out.